You might be surprised to find back pain is the single leading cause of disability worldwide. Back pain interferes with the way we live our lives and the way we work. And many people who suffer from back pain have been told that surgery is the only option, but that is not necessarily the case. Today, we're talking about a non-surgical option with our expert, Dr. Christopher Miller, and he has invited his patient, Cheryl Sturgis, to join us as well. Welcome back to A-West, Dr. Miller. Welcome, Cheryl. So let's talk about this. People suffer all over the world from back and neck pain.
Terry, back and neck pain is awful for a lot of people, and more than that, a lot of times they might get sciatica pain as well, which is irritation of the sciatic nerve. But a lot of times when they have that leg pain, they go to their doctors, they say it's sciatica, but the term sciatica is really more of a group of different conditions or complaints than an actual diagnosis, because when you look at the spine, there's actually 5 different nerve levels in the lower back that branch off the spine right through the buttock and the hip area, and they form the sciatic nerve, which is the largest nerve in our body, and it goes down the leg eventually to the foot. So the question we have to ask is what level is being irritated and what's irritating that nerve that would cause that sciatic pain. And the most common cause is degeneration of the spine and bulging discs for most people.
Yeah, some people can be diagnosed with this maybe temporarily through pregnancy. Even though it was a very long time ago, I just remember my last pregnancy, I had sciatic issues, and my doctor said, for you, it probably will go away after you give birth. But for people who have actually some kind of physiological problem within the spine, it doesn't go away.
And it can be up and down, but it can be shooting pain down the leg, numbness and tingling, sometimes just achiness in the leg. They have a hard time getting around often, where they have to sit frequently or try to stretch it out. And when that never goes away, that really wears on you. And it can be more than just pain, but it ultimately affects your quality of life.
Yeah, it becomes disabling in some instances for people because you're at a risk for falling and all those sorts of things as well.
Sure, because these nerves do much more than just cause pain or alert us there's pain. They control the function of our bodies. So these nerves in our legs control circulation, reflexes, muscle strength, could be coordination. So a lot of times these patients also complain about instability on their feet or lack of balance, and some of them unfortunately have fallen, and that can create other injuries on top of what they originally had.
Right. So Cheryl, what was going on with you? You suffered from extreme pain.
I was in an accident. We fast forward, yes, all my life I've had what he has been describing. But 6 years ago, I was in an accident, and I was the pedestrian and hit by a car. So that was the beginning of my big problems. And after that, at first I could not even walk for 10 days. And then when I could walk a little bit, I got a little bit better because I went to a doctor, and I had the burning and I had the nerve injections. And then on top of that, I went to physical therapy for 2.5 months. But all of that was just a little bit of a help, and then it would revert backwards again. But I was so that at least I could get around and do some things, even though I couldn't go any long distances. But then it got, the last 1.5 years, I was getting so that I couldn't do anything except read. I did a lot of reading.
Yeah, and you had been so active on your feet, a very busy, active job. So let's talk about the MRI that Cheryl had presented to you, because you were able to spot almost right away what the issue was.
Well, Terry, after we spoke about what had happened to her, we started investigating. We did a thorough exam. We got her MRI that had been previously done, and Cheryl kept telling me that all they said was she had arthritis in her spine. But when I looked at this MRI, the red arrows are pointing to horribly bulging discs in her lower back. Those black bulges sticking out towards the arrows are the bulging discs, where that white strip going down is the nerves in the spinal cord. So ultimately, I determined that's what was pinching these nerves, causing her back pain, the leg pain. It made it very difficult for her to walk, or as she said earlier, stand up straight. And all those treatments that she had done previously were to mask those symptoms. They really didn't do anything to fix what I just, displayed on your screen, and that's why her problem persisted. But fortunately, Cheryl was a great candidate for a decompression program. we've been able to correct those discs and regenerate them. So it's a happy day for me, and I'm sure Cheryl as well, to see her walking up here with me to get on the show, because she was in a lot of desperation when I first met her.
Yeah, and it's interesting because the way the DRX 9000 machine works and the program that you designed for Cheryl and so many other people across West Michigan, it's non-surgical, it is computerized. How was the treatment program for you, Cheryl?
Well, I got to tell you, at first I was skeptical, but I had been praying for a miracle. I didn't know where it was going to come from, but when I saw your program, I saw Dr. Miller on it, and I thought, I don't have anything to lose. I've already spent thousands. I've spent lots of time, and I did everything I could do on my own after that. So how has it helped? My goodness, the second treatment, I got off that machine, and I was amazed my back could hold itself up straighter.
Oh.
And the swelling went down in my foot, and I actually noticed my foot was angled more straight like it should be, because I'd been walking with it out. And you know how you tell your mind, don't do that, doesn't work. But all of a sudden, it was working.
Wow, and the treatment program that you went through with Dr. Miller, it was custom tailored for exactly what Cheryl needed in those specific areas in her spine and neck that needed to be adjusted.
Exactly, Terry, and there's a start and a finish to these programs. Cheryl's not quite done yet, but we're getting close, and you know, again, the goal is to actually correct the condition and get their spines healthier and get that pressure off the nerves so they can get back and live a normal life once again. It's not about just temporarily masking the pain, and I think that's the big difference in why Cheryl did so well.
Yeah, that's a big key. So let's talk about a special that you have for 8 West viewers, people who may be sitting at home suffering.
Yeah, and just don't give up. I mean, that's a lot of credit to Cheryl to keep persevering after 6 years of struggling and dead ends. But if they call our office today, Terry, for $49, we'll do a consultation, an examination. Also, if they have an MRI, we can review that together, and I'll explain to them what's going on and what their problem is. And we'll take these steps to not only determine what's wrong, but see if they do qualify for our spinal decompression program, where we can help them turn their life around as well.
Do you feel like you got your life back, Cheryl?
Yes, a tremendous amount of it. I mean, my mind isn't caught up with my body that much yet, if that makes any sense.
Yeah, but that'll come.
Yeah, because I still feel like I need to be closer when I park.
Okay.
And to a certain degree, some of that's, you know, it's gonna always be there. But yes, I can walk in a store and walk through it. I don't necessarily have to hang on to a grocery cart. I like to fix meals for my families, and I plan on doing that for this Christmas.
And Thanksgiving, it's just around the corner.
Well, I've gotten invited out, so I won't have to worry about that one.
That sounds good. Well, thanks so much for stopping by 8 West. And don't go anywhere. 8 West, we'll be right back after this short break.